All right, I'm going to go ahead and get started. My name is Cara Damon. I'm the program manager for Healthy at Hopkins on site at the hospital, and I am a registered dietitian, certified diabetes educator, and just generally excited to talk about the topic of being heart smart and preventing and managing heart disease today. It is Heart Month. February is American Heart Association's Heart Month, and we do our part to raise awareness about the risk of cardiovascular disease with everyone, and especially in the month of February, how this condition can affect women. So more about that, and let me begin the presentation. As I mentioned, if you're just joining me, please feel free to use the chat function. I will review the chat at the end to see if there are any questions that came up during the presentation. If there's something really urgent, you can also manually unmute yourself to speak over the phone. But just for audio purposes, I do have everyone muted at the moment. All right, getting started. Heart disease is a topic that many of us are at least initially familiar with as something that really affects everyone. One American dies of heart disease every 40 seconds, and it is the leading cause of death in the US and across the world. There are some couple figures on here about health costs, and these costs include health expenditures and loss of productivity. That $316 billion attributed directly to heart disease in the United States. So a very big emotional, social, and financial impact, just given that we have so many individuals affected by heart disease. It is a class of diseases. When we say heart disease, it's multiple diseases that affect, it may also be called coronary heart disease or cardiovascular disease, that generally just affect the heart and the blood vessels. And most commonly, this is referring to a buildup of plaque in the arteries, which can lead to heart attack, stroke, chest pain. And we know that heart disease and the diseases contained underneath of it can be prevented with the right tools, resources, education, and lifestyle factors. So before we make changes to prevent heart disease, it's just important that we know what factors contribute to heart disease to begin with. So these are the risk factors that increase your chances of experiencing heart disease. And there are factors that you cannot change or control, and there are many more that you can change. And these are on both sides of your screen as non-modifiable risk factors and modifiable risk factors. And we really are going to take in this presentation a deeper dive into two of the modifiable risk factors, specifically blood pressure and cholesterol. These levels can be monitored over time if you get your lab work done regularly and visit a PCP or primary care provider. So when we're speaking of the importance of blood pressure or getting your cholesterol, it really speaks to knowing your risk for cardiovascular or heart disease. If you've heard myself or Erica this month, we are certainly talking about the importance of knowing the changes that have happened to the blood pressure guidelines. And blood pressure, we know, or high blood pressure, stresses the heart muscle, and it can cause it to work harder, which can cause damage to the heart over time if blood pressure isn't controlled. So factors that impact blood pressure control include body weight, salt intake, alcohol intake, physical activity level. And we know the way these risk factors affect our heart and change our risk for heart disease. Certainly, we can do more to address when our blood pressure starts to be elevated and take action earlier. So this recommendation, that knowledge informed the recommendation that the American College of Cardiology and American Heart Association Task Force took into consideration when releasing new guidelines for blood pressure. So high blood pressure used to be classified as a blood pressure reading of 140/90 or higher. But knowing what we know now about the risk for heart disease, it has been updated to be 130/80 or higher. This is a very big change that has the potential to affect millions of people. And if your blood pressure, for example, if you've taken it recently, is 121/82, that might have been considered perhaps pre-hypertension before, but you can see now that this would actually be categorized as hypertension stage 1 because that diastolic is above 80, the bottom number being above 80. So I do encourage you, as you're considering your risk, to also know your blood pressure and know where you stand with the new blood pressure guidelines. High blood cholesterol also plays an important risk in heart disease, and cholesterol is a waxy substance that is made internally by our liver that helps our bodies make certain hormones, and we know that it is also found in animal-based foods like dairy, meat, eggs, as those animals also make cholesterol in their bodies. So our bodies have the potential to create all that we need as far as the cholesterol that we need, our liver can make. And that is why we should limit the intake of cholesterol from foods. But since our bodies and metabolisms are all different, we all different in the amount of cholesterol that we actually absorb in our diet, we know that some people see more of a change in their lab values when they cut back on dietary cholesterol versus some don't see as much of a change. And with new nutrition guidelines, these are the dietary guidelines that actually came out in 2015, so about 3 years ago now. I want to make a distinction between the cholesterol that you have drawn, the serum or blood cholesterol, and dietary cholesterol. So it has been recognized that dietary cholesterol has much less of an effect on your blood cholesterol levels than previously thought. And due to this research, the dietary guidelines no longer recommend a maximum amount of dietary cholesterol intake per day for most people, since we do know that we're creating cholesterol in our bodies. But that said, they still do encourage Americans to limit the intake of high cholesterol foods that also provide significant amounts of saturated fat in them. And that would really be things like meat and cheese. And you may have heard, for example, there are some cholesterol-heavy foods that maybe don't contribute as much to dietary or serum cholesterol and maybe don't have as much saturated fat. So people are going a little less harshly on those foods, such as eggs or shrimp, also because we know that they provide other healthy nutrients such as protein, choline, vitamin B12, and those can be really important sources of those nutrients too. So since we know that high intake of dietary cholesterol does not always lead to high blood cholesterol, what does cause high cholesterol? And we know that cholesterol levels are influenced by several factors. Some factors can be controlled, such as your diet or, in some respects, your physical activity or weight. Others, like age, genetics, really you don't have as much control over. So the factors that influence our blood cholesterol, similar to our risk for heart disease, can be separated into modifiable and non-modifiable risk factors, and that we can make a big influence on our cholesterol levels through the modifiable factors. So I am going to speak more specifically about impacting these values with cholesterol and with heart disease. And just briefly here, poor diet, this first bullet point, really means a diet that is high in saturated fats because they raise that LDL cholesterol. unhealthy weight, overweight or obese individuals do see a rise in cholesterol, and that is really more of an association that we see. Physical inactivity. Regular physical activity can help to lower LDL cholesterol and assist with weight loss, which can have its own benefits. With smoking, we know that that can raise your LDL blood cholesterol as well, LDL being that quote-unquote bad cholesterol. Genetics, genes can determine how much cholesterol your body makes inherently. Age, cholesterol can increase with age. Gender, women typically have lower cholesterol than men before menopause. Men typically have lower HDL cholesterol than women, and that is the quote-unquote good cholesterol. So let's take a look at how high cholesterol levels themselves contribute to heart disease. And this is really about knowing your numbers, again, knowing your risk with cholesterol numbers and heart disease. So to keep our hearts healthy, it's important to keep our cholesterol levels and triglyceride levels in check. And really that brings up the question, what should we be aiming for? Many people are familiar with the cholesterol panel. If you're not, here's some recommendations that do come from the NIH. So for heart health, total cholesterol, which is calculated using your HDL, LDL, and triglyceride levels, would be optimally less than 200 milligrams per deciliter, and that would be desirable. Triglycerides here, this bottom box, which are another form of fat in your blood that impact heart health, would ideally be under 150 milligrams per deciliter. Our next slide has HDL and LDL recommendations. As I mentioned, HDL is colloquially known as that good or healthy cholesterol. One of its main functions is to help carry bad cholesterol out of the body, and it's thought to prevent excess cholesterol from building up in your arteries, forming plaque, and causing those blockages. So HDL, a healthy HDL level is thought to lower your risk of heart disease, which is why we do call it good cholesterol. And a desirable range for that would be greater than 60 milligrams per deciliter. And LDL cholesterol, which I referred to as bad cholesterol, or you can think of it as lousy cholesterol, making that association with the L, stands for low density lipoprotein cholesterol, and it's thought LDL cholesterol carries cholesterol through the bloodstream and can deposit it on artery walls, which can contribute to development of plaques. So a healthy range for LDL cholesterol is ideally less than 100 milligrams per deciliter. But that said, these numbers, it's really good to work with your healthcare provider or a PCP to develop a plan for how often you should check your cholesterol and what targets you have or your doctor may have for you, as that person will be able to look at your overall risk, your family history, your age, and take into account your lifestyle factors to give you an overall big picture of where you stand. So I strongly encourage that plan of action with a physician or another healthcare provider. A little bit more about triglycerides, another form of fat found in the blood. When you get a lipid panel, usually that lab test will include not only the different types of cholesterol, but triglycerides. These can also be made by our bodies and can be found when we're breaking down food after digestion. So triglycerides provide our bodies with energy and contain essential fatty acids that help our bodies grow and repair themselves, but as with cholesterol, there can be problems if we have too much in our blood. Excess triglycerides can make the blood thicker, stickier, and put us at risk for blood clots and increase the risk of heart disease. So triglyceride levels can be impacted by excess body weight, lack of physical activity, smoking, and certain diseases. And dietary factors can also play a role. We definitely know the impact of nutrition not only on triglycerides, cholesterol, and then that overall cardiovascular disease, but specifically with triglycerides, excess alcohol we know can be converted into triglycerides in the body. Excess simple carbohydrates, such as added sugars there, we can see in the top left quadrant. Refined white grains, trans fat, those can also cause triglyceride levels to increase. So those would maybe be categorized as poor dietary habits if those are consumed in excess. Good dietary habits can also help control triglyceride levels. So studies have found that reducing added sugars and trans fats while increasing your intake of healthy, unsaturated fats can cause a 10 to 20% decrease in your triglyceride levels. So very good tip if you are someone that's looking to reduce those levels. Increased omega-3 fatty acids, and you can see that we have a picture of salmon, which is known to be a source of omega-3 fatty acids, along with physical activity can also lower your triglyceride levels. Drinking alcohol in moderation and not in excess can also be a positive lifestyle change to affect your triglycerides. And making all of these changes simultaneously, if they're applicable to you, has been found to reduce triglyceride levels by 50% or more. So introducing atherosclerosis. The three lab values we've talked about so far, being blood pressure, cholesterol, and triglycerides, are all risk factors for heart disease since they contribute to atherosclerosis, a condition which increases your risk of heart disease. It is a buildup of fatty deposits, which are called plaques in the arteries. And the plaques stick to artery walls, as this picture illustrates, and it can make the walls thicker, really narrow that opening through which blood flows through, and then in turn that can reduce blood flow throughout the body, and that can limit the amount of oxygen being provided to cells. So we know these plaques are made from cholesterol and other fatty substances. In addition to high cholesterol, high triglycerides, and high blood pressure, smoking is also a risk factor for developing these plaques. Atherosclerosis is harmful in the short term since it decreases the flow of blood to the body tissues, but in the long term, it really can lead to the increased risk of these diseases. And we know that it can lead to heart disease, angina, which is that chest pain from reduced blood flow in arteries of heart muscles, peripheral artery disease, or PAD, and that would be caused by plaque in the arteries of the extremities, commonly in the legs. CAD, in which plaque in the neck arteries that supply blood to the brain is present. And also chronic kidney disease, causing kidneys to overwork or not be as effective. So this part of the presentation is dedicated more toward lifestyle and direct actionable steps you can take to reduce your risk for heart disease that increase the chances of having a healthy heart. And they're really applicable to anyone, whether or not you have already seen elevated numbers with your blood pressure, your cholesterol, your triglycerides, or whether those are all excellent for you. These are really the next steps to take or continue to take. So, having good nutrition, physical activity, and stress management habits are the three areas I'm going to focus on. We know that these can positively impact the health when done correctly and decrease the likelihood of developing chronic heart disease or other conditions. So starting with nutrition, As I just mentioned, nutrition really can play one of the biggest roles, modifiable risk factors that can influence heart disease. Nutrition habits, just moving back for a second, as a statistic, that nutrition habits, when considered as a whole, are really associated with almost half, generally it's said to be about 45% of all deaths that are from heart disease, stroke, or type 2 diabetes. So nutrition can play a huge role in reducing your risk. Fat. We may have went through a low-fat craze in the 90s, but now we know that it's okay and even healthy to eat fat, certainly in the right amounts and the right types. And in fact, 20 to 35% of our total calorie intake is recommended to be from fat. So not only is it a good source of energy, but it really does play several important roles in the body. It allows the body to absorb fat-soluble vitamins. Specifically, those are vitamins A, D, E, and K. Fat protects the internal organs. It insulates the body. It helps regulate hormones. And then also less healthy forms of fat can have that negative effect on the body. So what we know about fat and heart disease is high intake of saturated fat can contribute to heart disease. And if you replace saturated fats with unsaturated fats, it can lower the risk of heart disease by about 30%. Unsaturated fats can also help to lower LDL cholesterol and triglycerides, and saturated and trans fats can increase the risk of heart disease and raise LDL cholesterol. So where do we find these fats? Some types of good fats you'll hear are referred to as polyunsaturated fats, omega-3s, DHA, EPA, ALA, and monounsaturated fats. So polyunsaturated fats, or PUFA, PUFAs can reduce your LDL cholesterol, which can lower your risk of heart disease and stroke. They can also provide you with vitamin E, an antioxidant that can protect heart health. And there are really two important subtypes of PUFAs that your body cannot make and that you need to consume via diet. These are the omega-3s and the omega-6 fatty acids. We do know from dietary studies most Americans consume enough omega-6 fatty acid, but tend to fall short when we're talking about omega-3 fatty acids. Omega-3s are, as just said, an important part of the PUFA family since it's something that we can't make ourselves. We have to get from the diet. And we know that omega-3 specifically help regulate inflammation, essential hormones. They're associated with healthy blood clotting, and they can really be found in foods like fatty fish, like again the salmon pictured here, walnuts, chia seeds, flax seeds, and really this helps explain, if you are tuned into dietary news, why we are considering these certain foods to be healthy, and it will really be from those omega-3, the content of omega-3 fatty acids. And another type of polyunsaturated fatty acid I just mentioned are those omega-6s, and those can be found in plants, eggs, and certain vegetable oils like corn or safflower. And usually we're getting enough of those. And then the final type of healthy fat it would be good for you to know about are those monounsaturated fats or monounsaturated fatty acids, MUFAs. MUFAs help reduce LDL cholesterol and provide the body with the antioxidant vitamin E. So good sources here would be olive oil, canola oil, nuts, seeds, avocados, which again has that healthy connotation with those foods because of the content of monounsaturated fatty acids. On the flip side, there are less healthy fats, making that distinction between healthier fats and unhealthier fats when we're talking about this category of food. Saturated fats and trans fats really are implicated in being bad fats that raise humans' risk of heart disease. And these types of fats tend to be solid at room temperature. Trans fats specifically, they raise LDL cholesterol and can lower HDL cholesterol together, which is really raising bad cholesterol and lowering good cholesterol at the same time, and that can definitely increase your risk of heart disease and strokes. They have been eliminated in some foods, but not all, especially since there are small amounts in foods, like pre-prepared foods like fried foods, donuts, baked goods, cakes, pie crust, biscuits, stick margarines, because they do tend to increase the shelf life of those products, so they can be processed and then sit on a grocery store shelf for a while. So you can spot items that contain trans fat by reading the nutrition facts label or even the ingredient list. Manufacturers, though, can list trans fats as 0 grams when it contains up to about half a gram per serving. So one way to know whether it does have any trans fats or even trace amounts would really be to look for the ingredients list that says partially hydrogenated oil. And if it does, you would know that the product probably has small amounts of trans fats in it, which again can be listed as 0, even if there are amounts up to half a gram. So the American Heart Association does recommend that they just generally be eliminated from the diet because of such strong evidence on the way they affect our heart health. The second type here, saturated fats, they're another type of fat that can harm heart health and really should be limited in the diet. The dietary guidelines do recommend that less than 10% of our calories come from saturated fat. We know that they can raise your total cholesterol, your LDL, but that if you swap unsaturated fats in for saturated fats, it can reduce your risk for heart disease. So you might find saturated fats in things like coconut oil, animal fat like butter, cheese, and red meat, full fat items, and you can also see saturated fat on the nutrition facts panel specifically. Another area of the nutrition that can affect your heart health, big one here, is fiber, and it is a type of complex carbohydrate that our bodies can't break down or absorb. So after we eat it, it does pass through our digestive tract and is eliminated from the bodies via stool. So getting adequate fiber is one thing that helps keep your blood vessels and heart healthy. It can lower LDL cholesterol, balance blood sugar, manage weight, and fiber intake has been associated with a decreased risk of heart disease. And here are the recommendations for fiber. And this is according to the National Academy of Sciences. Men aged 19 through 50 should ideally shoot for 38 grams of fiber daily. And then women in that same age group really should shoot for about 25 grams per day. And then those recommendations do change a bit and get lower if you're over the age of 51, to 30 grams for men and 21 grams for women, respectively. So where to find this? Oats, half a cup of oats can give you about 8 grams of fiber. 1 medium apple, about 4 grams. Half a cup of green beans, pictured here, about 4 grams. And then a medium sweet potato with skin, about 4 grams as well. More ideas for fiber. We know that it can be found and consumed if you are eating whole unprocessed fruits, such fruits, vegetables, beans, whole grains, legumes, nuts, and seeds. Really great sources of fiber. And then on the flip side, heavily processed foods tend to have had the fiber taken out of them through the processing before you eat them. So tips for getting more fiber. At breakfast, if you are choosing breads or cereals, going for cereals and breads that are whole grain, that are higher in fiber. You can also even add fiber-rich toppings such as flax meal, chia seeds, berries, nuts. At lunch, again, if you're doing whole grain or foods with bread or grains, choosing those whole grains, adding beans or seeds to your sandwiches or salads, different types of veggies, or rather, such as carrots, celery with hummus, having an apple, just making sure you're picking fiber-rich foods. Similarly, at dinner, you are able to maybe bulk up burgers or meatloaf with oats or flax meal. You can add veggies or beans to sauces and soups. Or even with side dishes, instead of normal pasta, potatoes, or bread, trying some whole grain alternatives, brown rice, quinoa, millet, buckwheat. And then if you're someone that's not, if you feel like you're really not eating very much fiber at all and you would like to start increasing it, just as a note, you would want to gradually increase your intake over time, because if you go from very little fiber to a whole lot, you can actually increase your risk of constipation or abdominal pain, because it is something that our bodies grow accustomed to. So with that in mind, increase gradually, drink plenty of water, and it can help you better process the fiber and keep your digestive system healthy. Also, as you're looking for foods in the grocery store, I'll take a look. If the food has a nutrition facts label, if it has fiber, it will also be listed on the food. In our last area for lifestyle interventions for heart disease, specific recommendations about exercise. And the physical activity guidelines, we see that regular exercise at moderate to vigorous intensity can reduce the risk of heart disease by 30 to 40% and the risk of stroke by 25%. Huge benefits from exercise. So in addition to the heart disease risk reduction, exercise itself also can improve blood circulation, help or maintain your body weight, improve blood cholesterol, prevent and manage high blood pressure, and then also act as stress relief and tension relief. Specific recommendations around exercise are 150 minutes a week of moderate exercise or 75 minutes a week of vigorous exercise. So if we're thinking about our aerobic activity, breaking that into 30 minutes 5 times a week of moderate intensity, you can even take that 30 minutes and divide that into 2 or 3 segments per day, which would be 10 to 15 minutes per day to meet these recommendations. We know you can still see those benefit from aerobic activity with 2 15-minute sessions per day if you feel like you don't have time to do 30 minutes all at once. We know a bit more that what matters the most is the total time you spend on that aerobic activity over the course of a whole day, not that it all happened at 30 minutes at once. When I'm speaking of aerobic activity, I'm specifically referring to different exercises that increase your heart rate, get your cardiovascular system engaged. It's good for heart health because it does allow your heart to become more efficient. So to add more time, find ways to take a walk as a break at work, take the stairs, park farther away at stores, doing anything you can to get more aerobic activity in your life is the best start here. Every little bit counts, so you can start there. You can also make exercise a social activity, enlist friends and family to join you in classes, take walks or bike rides, create a home gym. And these are activities that are separated into moderate intensity or vigorous intensity when you're doing them, referring a bit more toward how it affects your heart rate. And finally, stress relief. This area is getting much more attention, but stress certainly has an effect on heart health. Stress itself can increase blood pressure, heart rate, and blood sugar. And with stress, chronic or acute, it can impact the heart by releasing hormones, adrenaline and cortisol specifically, that increase blood pressure, heart rate, blood sugar here. And your body really, you can think of it as being prepared for fight or flight. So stress is encouraging your heart to work harder and pump that blood to tissues in case you need to act. But over time, if this is a chronic thing, that extra pressure, the increased stress can put extra pressure on your arteries from continued use, continued work, and then lead to unhealthy coping behaviors, even if it is very much impacting your life, such as smoking, binge eating, excessive drinking, which then also can impact heart health. So some tips. It's very important to have a plan for your stress relief and keep your body and mind healthy and balanced over time. Stress relief strategies don't necessarily work, or rather, each tip wouldn't necessarily work for each individual person. Your stress relief strategy really does need to be personalized. Not everyone would find hiking relaxing, but others will. So knowing what works for you is very important and what you can turn to for your stress relief. And these are just some ideas that can help you get started in developing your own plan if you don't have one. And really, it's just important to choose activities that you most enjoy and that provide you the greatest stress relief. And once you decide what works for you, it's important to build that time into your schedule and into your life. Ideally, you'd aim for about 15 minutes of stress-free me time every day. And that can be something like reading the paper first thing in the morning, taking a walk during lunch, reading a book before bed. It's about making that time for yourself. So in conclusion here, we've gone through these 3 areas of your life that have the power to keep your heart healthy over time. And we know that having good nutrition, exercise, and stress management habits very much can make a difference and improve heart health. And putting these recommendations on one slide, everything we talked about, or rather, these are the key actions we talked about here. Quit smoking if you smoke. Reduce your intake of saturated and trans fats. And choose healthy fats, those monounsaturated and polyunsaturated fats. Get moving anytime, anywhere you can. Increase your physical activity. Every little bit counts. Get your veggies, get your fruit, and get your fiber. So I have left a couple of minutes for questions. And I'm going to go to the chat first and foremost. If you have a question, please enter it into the chat. And then also, if you do want to speak over the phone instead, send me a chat. I can unmute you, or you can unmute yourself. Any questions on what we just covered? Going to go ahead and unmute everyone. I haven't seen anything coming through chat. So everyone's speakers are live right now. Any questions? right, well, I want to thank everyone for our presentation on Heart Smart, preventing and managing heart disease. For any follow-up information, please feel free to reach out to me. My email address is kdamon@jhmi.edu, or you can email healthy@hopkins@jhmi.edu, and we'll be happy to address anything there.